Okay, so today's tutorial is having a look at the blood flow through the heart. So we have a picture of the heart, and we first of all look at the different chambers involved. So you've got the left atrium and left ventricle, and right atrium and right ventricle. Now remember that the left side of this heart is not according to your left, it's according to the picture's left. So if someone actually owned this heart, it would be their left side, not your left side. Now I've drawn in some red and blue blood vessels. These are the four major blood vessels that we use in our body, and probably the most important one is this one here, the aorta. Now it delivers blood all around the body from the ventricle. Now remember that the ventricles are really quite large because they need to pump blood to particular parts of the body. The atrium, or the atria for plural, they are quite small because they only need to receive blood. They don't have to push the blood as far as the ventricles do. So the aorta will send blood to the body, and there is also a valve in here just so it doesn't go back into the left ventricle, and that's called the aortic valve. Just connects with the name of the blood vessel that it belongs to. So that goes to the body. Now the other ventricle, the right ventricle, that will send blood to the lungs. And this blood vessel here is actually called the pulmonary artery. Now you can remember that because pulmonary means lungs and artery means, or A for away, the artery carries blood away from the heart. So to the lungs from the heart, pulmonary artery. And so that blood goes outwards, and that also goes through a valve as well. Okay, so that's the pulmonary valve. And again, the right ventricle is quite large because to get it to the lungs you need quite a bit of power. It is slightly smaller than the left ventricle because getting blood to the lungs doesn't take as much effort as getting blood around to the body. Now, once the blood has gone to the lungs from the right ventricle, it collects oxygen, drops off carbon dioxide, and then comes back to the heart. And the way that it comes back is into the left atrium. So it actually comes via the pulmonary vein. So again, there's that word pulmonary, meaning lungs. Vein means to return the blood to the heart. Oops. So we have the blood coming in through the pulmonary vein. It's high in oxygen, so high O2 levels, and it's lower in carbon dioxide, so low CO2 levels. And it will go into the left atrium. The left atrium will send it through a valve into the left ventricle and around to the body again. Now this valve also has a name, and that's the left atrioventricular valve. So the left atrioventricular valve stops the blood going back into the atrium from the ventricle, and what actually causes it to open, it's like a swing door. You've got to have enough pressure or enough blood to press on that swing door or on the valve, and it swings open, and it just doesn't swing back the other way though. So as soon as that ventricle fills up with blood, those flaps on the valve shut and the pressure pushes against them, and then they won't open back the other way. So they only open in one direction. Same with the aortic valve, same with the pulmonary valve. Now, once the blood has gone through that left ventricle and out the aorta, it goes to the body, and because there's lots of oxygen in that blood, it drops it off in the body, picks up some carbon dioxide, and that carbon dioxide then needs to get to the lungs, but it doesn't have enough power to get there by itself, so it needs to be repumped by the heart. So once the blood has entered the body, and in our case, we're looking at getting to the muscles. So once it's left the muscles, it comes back to the heart via the right atrium, or into the right atrium, sorry, and that blood vessel there is called the vena cava. Now in our case, we're looking at the inferior vena cava. So inferior means below. So we're just looking at the body parts that are below the heart. The superior, or the vena cava tube that is above the heart, that collects the blood from the brain and the neck and that sort of thing. So we don't really need to worry about that one. So the blood will come in through the vena cava into the right atrium. Again, it hits a valve, and in this case it's called the right atrioventricular valve. I'm just going to write right AV valve for short. And then into the right ventricle, again it fills up, shuts the valve closed, and then enough pressure builds up again in that right ventricle and pushes out through the pulmonary valve into the artery and to the lungs to pick up extra oxygen. So what I'll do for you now is quickly summarize how that blood moves. So if we start at the body, the blood will go to the body through the aorta, and the body will use up all the nutrients that was in that blood and then drop off the wastes. That dirty blood will then enter the heart at the right side into the right atrium. It will go down into the right ventricle, and then what will happen is the right ventricle will push it out to the lungs. Now at the lungs, the oxygen will be reintroduced into the blood, so we'll get fresh oxygen. We'll drop off all the waste such as the carbon dioxide, and that new fresh blood will then come back to the heart to be repumped again. So once it goes into the top chamber of the heart, goes through that valve and back to the left ventricle to be repumped to the body. Now that happens about 80 times a minute because that's your heartbeat. So that's the basic blood flow through the heart. The next tutorial you can have a look at is the blood flow throughout the body and the lungs.